Very good afternoon to everyone. Very soon we will be starting the program, and we are waiting for Principal Sir and respected speakers of the day. Please have patience and please switch off your cameras. Thank you.
Ma'am, I think the team of doctors have joined already. Can you please check, ma'am? Shwetamri, ma'am?
Yes, ma'am, I am
Shwetamri, ma'am?
checking. Yeah, yes, ma'am, I am
Yeah.
checking.
I think the doctors have joined. Yeah, maybe
Yeah, good
you please
afternoon.
unmute yourself. Yeah, good afternoon, sir. Good
Hi,
afternoon.
good afternoon. We are here.
Yeah. Yeah, has
We are
Dr.
there.
Pani
Yeah.
joined? Has Dr. Pani joined? Just check.
Yes, ma'am, I am checking.
Yeah.
I think Dr. Pani is busy with some meeting. I'm trying his
Acha,
number, so I think we can
acha.
start with the program, and he can join it later on.
Yeah. Maybe. Ma'am, I'll just give him a call once and maybe then I will just tell you. Yeah.
Good afternoon.
Good afternoon, Dr. Piyush and Dr.
Dr. Anushi.
Anushir. Right. Nice to see you, and thank you so much for taking your valuable time to our program. So it's a theme of concern to women, and you are addressing and taking care of this such a important issue. So, very congratulations to you for that, and welcome to the program. We'll about to start in just few minutes.
So Dr. Geeta, hello, can you hear us? You're muted. You're muted.
Yeah, myself, Dr. Geeta Mungia from Bhaskaracharya College of Applied Sciences.
So Dr.
And
Geeta, Dr. Piyush and I will be asking each other a few questions.
okay.
So is that okay with you?
Yeah, definitely, no issues.
Yes, sir, definitely. Yeah.
And
Ma'am,
after that, at the end of it, we can have general questions from anyone.
Definitely, yeah, that's
Okay.
good. It should be an interactive session that will be more interesting to all participants, I suppose.
Yes.
Yeah, sure, sir. Actually, we have a lot of participants, so some are joining. We are having a live streaming at YouTube also, because we had around 350 participants for the program. So I think we can start with the program. Dr. Shivani,
yes,
if it is
ma'am, I think Dr. Pani is busy with some meeting. He is cancelled
yeah, I
the call.
called him.
So whenever
Actually,
he joins, you can welcome him, yeah, and he can give us, you know.
We'll do it. Okay, so we can start with the thing. Right?
Okay, ma'am.
Dr. Shivani, please take over.
Yes, ma'am, I am starting.
Yeah.
Is the live streaming going on, ma'am? Just check. Shwetamri, ma'am, is the live streaming going on?
Yes, ma'am, I saw the message, but I am not sure about that.
Alankrita, can you please check whether the live streaming is on?
It's on.
Yeah. Okay, ma'am.
Yeah,
Ma'am,
all
you
set?
can start now, please.
Start.
Recording is on, ma'am. Recording. Sir, we would like to record the session. Will you give us the permission, sir?
Yeah, okay. That's absolutely fine.
You're
Yeah.
okay with it? Yeah, sure. Okay, all ready to go. Yeah, start. Yeah. Thank you.
सभी को नमस्कार. Am I audible to all of you?
Yes.
Yes, ma'am. Very much audible.
सभी को नमस्कार. मैं डॉक्टर श्वेतांबरी भास्कराचार्य कॉलेज ऑफ अप्लाइड साइंस की तरफ से सभी का हार्दिक अभिनंदन करती हूँ. नारी तुमसे केवल श्रद्धा हो, विश्वास रजत न पक्तल में, पीयूष स्रोत सी बहा करो जीवन के सुंदर समतल में. आज हम नारी हित और सम्मान की अपेक्षाओं सहित ब्रेस्ट कैंसर अवेयरनेस प्रोग्राम आयोजित कर रहे हैं भास्कराचार्य कॉलेज ऑफ अप्लाइड साइंसेज, दिल्ली विश्वविद्यालय का नेक ए ग्रेड एवं डीबीटी स्टार। भास्कराचार्य कॉलेज में जैव चिकित्सा विभाग चिकित्सा संबंधित विभिन्न कार्यक्रमों का आयोजन करता है। वुमेन डेवलपमेंट सेल नारी उत्थान से संबंधित सभी गतिविधियों का आयोजन करता है। ये अवेयरनेस कार्यक्रम जैव चिकित्सा विभाग एवं वुमेन डेवलपमेंट सेल ने मणिपाल हॉस्पिटल के संयोजन में आयोजित किया है। इस कार्यक्रम के लिए मैं भास्कराचार्य कॉलेज ऑफ अप्लाइड साइंसेज के प्राचार्य जी डॉक्टर बालाराम पानी, जो दिल्ली विश्वविद्यालय में सभी महाविद्यालयों के अध्यक्ष भी हैं, से का आभार प्रकट करती हूँ कि हम सभी कार्यक्रम उनके मार्गदर्शन में करते हैं तथा हमारे महाविद्यालय में जैव चिकित्सा विभाग एवं वुमेन डेवलपमेंट सेल बहुत ही गतिविधियों का आयोजन करता है, जिसमें सक्रियता देखते ही बनती है। आज का कार्यक्रम का एक अनुपम उदाहरण है। अब मैं डॉक्टर नेहा सिंह जी से अनुरोध करती हूँ कि वे आगे का कार्यक्रम सुचारू करें। ओवर टू डॉक्टर नेहा।
A very warm good afternoon to all present here. I welcome you to this webinar on breast cancer awareness. This is a part of celebrating this month of October as Breast Cancer Awareness Month. This presentation is in collaboration with Manipal Hospitals, the Department of Biomedical Science of Bhaskaracharya College and the Women Development Cell of the college have come together to bring about this event. Women all over the world face the risk of breast cancer. This is a debilitating condition. However, researchers all over the world are working towards creating a world where breast cancer would have no power over lives. The ability to predict a woman's breast cancer risk and early diagnosis techniques are the key to effective management of the disease. With hope in our hearts, we undertake this initiative on breast cancer awareness. Our reputed speakers today are Dr. Piyush Master, who is Head of the Department Consulting, Medical Oncology Sciences and Breast Cancer Management at Manipal Hospitals. He is a specialist in gastrointestinal, gynecological, hematological, and thoracic malignancies. Dr. Anishil Munshi will also be joining us. He is Head of the Department and Consultant for Radiation and Oncology Sciences. He is specialist in breast, brain, and lung cancers, and he is also a radiotherapist. So I request our speakers to please enlighten us on this topic, which is of relevance, which may become of very great importance, is even today of great importance for us. Thank you very much. Over to you, sir.
Yeah. Well, thank you, ma'am, for the kind introduction. I'm Dr. Piyush Bajpayee, and besides me is my senior colleague, Dr. Anushil Munshi. So we would take you across the screening, the preventive measures, and the screening, how to catch breast cancer early, what are the recommendations, and also the current challenge that India is facing. So, for the benefit of larger audience, I would ask Dr. Munshi that what exactly is breast cancer? Could you please explain?
Screen sharing for me.
Yeah.
I hope the screen is visible.
Yes, sir. No, I think not.
Is the screen visible now?
Are the slides visible to you?
No, sir. Please share your screen or present now.
So please share your screen.
present
Sir,
now.
are you able to present? Are you able to present, sir?
Can you see now?
Yeah, it's coming. Aman Raj. Yeah.
Yes.
Yeah.
It's
Okay.
very much visible. So, if somebody is not able to see the screen, you can pin the screen, right? It's for the participants.
Yeah. So, Dr. Munshi, what exactly is breast cancer? Can you just share some basic information on that?
So good afternoon to everyone, all those who have joined us this Saturday afternoon. So the question is, what exactly is breast cancer? So any cancer is an abnormal growth of cells. And when we talk about breast cancer, it's an abnormal growth of cells in the duct lobular system. So here you can see this is the duct lobular system of the breast. And these cells in this duct lobular system start multiplying on their own, and they do not recognize the inhibitory signals that are supposed to stop them. And that is what leads to this abnormal growth of cells that you are seeing here. And that is what happens actually in a breast cancer patient.
So it means that the cancer cells are from our own body, and it's not that we acquire them from somewhere else. So, Dr. Munshi, having said that, would you elaborate the problem that India is facing in terms of breast cancer specifically?
Now, breast cancer is actually a global disease, and India is no exception. So if you see, this is the global cancer incidence. There are 18 million new cancer cases that happen in the world. And this, you can see the distribution all over the globe. And out of these 18 million, approximately 2 million are breast cancer patients. So that is a huge number. And not only that, approximately 627,000 patients undergo mortality every year throughout the world, and that again is a very, very huge number. As far as India is concerned, we have a population of 1.25 billion. There are 10 lakh cancer patients every year. 30 lakh patients exist in our country, and cancer incidence in our country ranges from 58 to 133 per 100,000 patients. Coming specifically to breast cancer, as far as 2018 data is concerned, breast cancer is the most common cancer in women in India, and it accounts for 14% of all cancer in women. And new cases are approximately 1,62,000. Remember that we have around 10 lakh cancer patients in entire country, all combined, and out of which 1,62,000 are breast cancer patients. And out of these, a huge chunk, almost half of these are actually dying every year. 87,000 patients with breast cancer are dying every year. So currently, overall, 1 in 28 women is likely to develop breast cancer during her lifetime in India. 1 in 22 women in urban, and 1 in 60 women in rural setting is likely to develop breast cancer in India. And this is the age-wise distribution. So you can see between starting from the risk starts from around 30 to 34 years of age and kind of tends to go down a bit by around 64 or 65 years of age. This middle age group starting from 35 to almost 60 years is the kind of a group which has most number of breast cancer patients.
So, having elaborated on the problem that India is facing, Dr. Munshi, what actually is the cause of breast cancer?
So, as you know, everything that happens tends to have some reason or other, but sometimes you don't find any specific reason. But we have been able, the medical fraternity has been able to pinpoint some risk factors, specifically in the case of breast cancer. Now, these can be broadly divided into genetic factors, environmental factors, lifestyle factors, other factors, and there are many times no known factors. So these are the broad classification of factors that can lead to breast cancer.
So there were certain causes that you elaborated, and amongst them were genetic and environmental factors. What can be done to prevent breast cancer?
So as the good old saying goes, prevention is always better than cure. But we have to realize that there are risk factors for breast cancer, but some of the risk factors one cannot do anything about. For example, you cannot do anything about age. You cannot do anything about the race. You cannot do anything about the family history, or the onset of menstruation, or the age of menopause. So these are risk factors. There is no doubt about the fact that these are risk factors, but these are the risk factors for which you can't do much. So, but there is hope. There is hope because there are factors for which you can do something, and you must do something. And these are the factors, for example, they can be controlled. For example, the amount of exercise, alcohol, smoking, breastfeeding, or decision not to have children, or obesity. So these are all the factors that are kind of within our control to a large extent. For example, take the example of lifestyle. So gross obesity, tobacco in any form, for example, smoking or anything of that sort, alcohol, especially heavy intake of alcohol, and other factors. These are the lifestyle factors that one needs to be aware of. So healthy weight is a very important thing, and it's important not only for other reasons, but also specifically in the case of breast cancer as a preventive measure also. So one needs to be as lean as possible. We should not become underweight, but we should try to become as lean as possible. And gaining weight needs to be avoided at all ages, whether you are a 20-year-old, whether you are a 30-year-old, whether you are a 50-year-old. You need to avoid gaining excess weight and try to remain physically active. So these are very, very important things that one needs to remember, and often one tends to forget. So the international recommendations, if you see, at least you need to have 150 minutes of moderate intensity physical activity throughout 1 week. 1 week you should have 150 minutes of moderate intensity physical activity, or 75 minutes of vigorous intensity activity. Now you decide based on your lifestyle what suits you. You don't need to go over the board or exert yourself too much. Whether moderate suits you, light suits you, or heavy suits you, you can titrate the amount of minutes according to that. And preferably don't try to do everything in 1 day. Okay, my week's quota is over. Try to spread it throughout the week. Now diet is also, and we keep on telling this again and again, that diet can be a very, very important factor, and everything is kind of related, your weight and your diet and things like that. So healthy diet, especially with an emphasis on plant resources, 2 to 3 cups of fruits or vegetables every day, using a variety of vegetables, whole grain, legumes, and so on and so forth. And on the bottom side, you see the things that you need to definitely avoid: sugary drinks, fast foods, processed foods, alcohol intake, preferably stop it. So the other thing is that often we are asked about, okay, what dietary supplement I can take to which is proven that it will give me full protection against breast cancer. The answer to that is there is no dietary supplement that claims. I mean, it's just advertisement campaign, and I don't think we should succumb to those false campaigns. Don't waste money with these overpriced products which you see in the market or on-site platforms. They are of no help in preventing if they claim that they are totally wrong. Best for mothers is to breastfeed exclusively for 6 months, perhaps more, and breastfeeding promotes healthy living and weight control both in women as well as infants. So as I said, and I repeat again, smoking is an important factor not only for other cancers but also for breast cancer. It's enemy number one. So one should definitely try to avoid or give up smoking if someone is smoking. So my take-home message would be: take all the steps to promote a healthy lifestyle in you and your family. If you're a smoker or use tobacco in any form, stop its use today. And especially, I'm saying this because a lot of youngsters these days, we are seeing smoking, and I don't think it's a healthy trend at all. And one should definitely discourage it in all forms. And charity begins at home. We have to look about our own health first. So the other message I have is that regular exercise and taking care of one's diet are again very, very important and essential things. And finally, I would like to conclude my part of the message before Dr. Piyush gives his part of the message. And I would like to conclude by saying that it is health that is real wealth. And as the father of the nation aptly put it, and it's not just pieces of gold and silver that is wealth. Your health is actually your real wealth. Thank you.
So thank you, Dr. Munshi. Well, I would be now covering on how to go about detecting this problem early. So
Dr. Piyush, see, the question is that prevention is obviously the first preference, but then we know that in spite of preventive measures and in spite of all these measures that people take, still we find in some cases this breast cancer or a lump or a swelling that turns out to be a malignancy. Sometimes our aim should be to try to detect it as early as possible. So can you please tell us that why is early detection important to us? Does it really benefit? Does it really benefit to detect breast cancer early? Or even if you wait for some time, you delay it, everything the same. So can you please shed some light on this?
Yeah. Before I start, may I ask my audience, since we have changed the PowerPoint, can everybody see the slide currently?
Yes, yes.
Yeah.
Yes.
So your question, Dr. Munshi, is why is early detection of breast cancer important? You actually told the right thing. The statistics are showing an increased incidence of breast cancer, and this was 1.62 lakh ladies were diagnosed in 2018. Now, the sad part is the mortality, the deaths because of breast cancer, if you look per year, was nearly 80,000 plus, which means that we were losing out of 2 ladies, we were losing almost 1 person of breast cancer. The reason being is that what in India we are seeing, for the reasons that we do not have a very well-defined screening program system, or we do not have awareness to the level that is required as compared to the Western world. We are getting in our clinics nearly 70% of the patients who come are in a locally advanced or advanced stage. So that is what is the importance of screening. We might not be able to vary the incidence curve. We might not be able to bring down the incidence of breast cancer to a large extent. But what is important is by early detection and raising the awareness by doing such programs that we are doing today, we can make the people aware of signs and symptoms in symptomatic patients, and then screening by screening tests.
So Dr. Piyush, that brings us to the next question, that most of the diseases that we see in everyday practice have some early signs or early indications or early symptoms. Does breast cancer also give some early signs or symptoms that one should raise a red flag? Okay, I should consult someone for this. Is there anything of that sort for breast cancer?
So you very rightly said that there are early signs or symptoms which one should promptly report to their family physician, their gynecologist, or otherwise to their oncologist. So what could they be? And they are the most prominent ones. The most common one is a lump in the breast. So that is one of the most common ones, and a lump in the breast which usually starts as a painless lump. And now this is a myth that we find, that breast cancer to start with would be a painful, and therefore if a lump is not painful, it might not be breast cancer. So most of the times, early breast cancer, if it has to be caught early, the lump would be usually painless until unless it is neglected, and then it starts infiltrating the skin or the muscles, then it becomes painful. Then what is important is, if a lady is aware about the symmetry of her breast, and that is possible by doing self-breast examination, then one can catch any changes in those symmetry early. Skin retraction is another prominent symptoms which could be there. And likewise, nipple retraction, which is of recent onset, is important. Blood stain discharge from the nipple is again a red flag sign. Eczema or redness of the breast of recent onset is also important. So as one can see in the cartoon, these are the particular signs that I was talking of. One should be aware one should be aware of these changes happening in the breast.
So that means there are some signs and symptoms that can actually make us a bit alert. But the next question is that how do we detect, actually go beyond this and move to the detection stage?
So detection is it all starts by knowing one's body. It starts from one knows her a lady knows her own breast by doing a self breast examination, and it should start after the age of 18 years. The best time being a week after menstrual cycle. That would be the best time. The examination can be done usually under the shower or lying down position or a standing position. Well, there are several protocols available on the internet. The use of finger pads, one can use a massage oil or a shower gel, which can make the perception of the lump very, very sensitive. And the patterns where one should actually palpate or go around touching the breast should be the opposite hand for the breast. And there are patterns up and down. One can go in circles or in wedges, as explained in the cartoon. So these should be examined. And it is also important to note down any findings in the armpit also. It is important not just the breast, but the armpit should also be palpated by the person. So these are the ways one can actually do the self-breast examination every month, and this can help catch up those early lumps or changes, and one can then present to their family physician. It is not a very accurate screening method, but it is something is better than nothing, especially in corona times. Especially one is not able to come out from the house for regular mammograms. This is one of the most important ways to catch these sort of lumps earlier. So other thing is a clinical breast examination, and it is by an experienced or a trained physician or a clinician. Once a lady is going for a clinical visit, the usual way to do it is by a 3 fingers method, and again it is the pads of the fingers, each breast for 3 minutes. If palpated by a trained doctor, then one can actually detect a breast lump or an early breast cancer quite early. And usual position is a lying down position, and it can be done in a routine clinical visit.
So can you also, because I'm sure most of the young or the women that are watching this show, they would have heard the term screening a lot. So for them, for the benefit of the audience, can you please tell us that what does screening mean, and what are the methods of doing screening, and what is the benefit? Are there any pitfalls also? So can you shed some light on this very, very important issue of screening, because that I'm sure is in everyone's mind.
Yeah. So before I start upon screening, the previous two methods, the self-breast examination and the clinical breast examination,